Have you ever heard of a tooth that just stops? Like it stops growing, it stops moving, and it just gets stuck right where it is? It sounds pretty weird, right? But it's a real dental condition called dental ankylosis. So what exactly is going on when a tooth just refuses to budge? Let's dive in and find out. All right, so here's our game plan. First, we're going to break down what it actually means for a tooth to be fused. Then we'll look at the telltale signs, the clues that give it away. After that, we'll unpack the potential causes. And finally, we'll explore how dentists deal with this problem, because the approach is totally different for baby teeth versus permanent teeth. Okay, let's get right to the heart of it. What is dental ankylosis? It's way more than just a tooth that's a little slow on the uptake. To really wrap our heads around this, we gotta ask this central question. See, your teeth are normally in this constant, super slow state of eruption or movement throughout your life. So what happens when that entire process just screeches to a halt for one single tooth? This is it, ankylosis. It's when the root of the tooth literally fuses directly to the jawbone. A healthy tooth has this amazing thing called the periodontal ligament, which acts kind of like a tiny built-in trampoline, giving it just a little bit of flex and movement. But with ankylosis, that trampoline just disappears. The tooth becomes completely rigid, locked in place. It's like a fence post that's been set in concrete. No more give, no more movement. So if a tooth is literally fused to the bone, how would a dentist, or how would you, even spot it? Well, it turns out there are some very clear signs that they're looking for. Dentists are kind of like detectives here, and they're looking for a few key clues. The most obvious one you might see is a tooth that looks like it's sinking. But the real confirmation comes from x-rays, where you can see that missing trampoline space, and by watching how all the neighboring teeth are starting to react. Let's break down what these signs really look like. This is usually the dead giveaway. As all the other teeth around it continue their slow, natural journey upwards, the ankylosed tooth stays completely still. So over time, it starts to look like it's sinking down below the others, creating this really uneven line in the smile. And this is where you can see it's not just a one-tooth problem. A single stuck tooth can kick off a whole chain reaction. The teeth next to it might start to tilt into that empty space above the sunken tooth. And what about the tooth directly opposite it, in the other jaw? Well, with nothing to bite against, it can start to over-erupt, basically growing longer and longer. It really is a domino effect. So all of this really makes you wonder, why? Why does this fusion even happen? What triggers the body to just decide to lock a tooth directly into the jawbone? The exact cause isn't always 100% clear, but we've got some pretty strong suspects. It could be something obvious, like trauma, a big knock to the tooth that damages that ligament. But it can also be more subtle, like constant weird pressure from the tongue. In some folks, they might just be born with a smaller than normal space for that ligament to even exist. But bottom line, something disrupts the body's natural repair process, causing bone to grow where it just shouldn't. Okay, so now that we've got a handle on what might cause it, how do we fix it? Well, the game plan depends entirely on one really important thing. Are we talking about a primary or baby tooth or a permanent one? For baby teeth, the goal is pretty simple. Get it out of the way for the adult tooth that's coming in. But for permanent teeth, the goal is totally different. It's all about saving and working with what's already there. Let's look at each path. First up, primary teeth. When a baby tooth gets ankylosed, the biggest worry isn't really the tooth itself. It's the permanent tooth that's waiting in the wings, ready to take its place. So the treatment here is usually pretty straightforward. Step 1, the dentist extracts the ankylosed tooth to clear the runway for the incoming permanent tooth. Then they'll often put in something called a space maintainer. You can just think of it as a little placeholder that keeps that gap open, making sure the new tooth has a nice, clear path to come in straight. But what if it's a permanent tooth that gets stuck? You can't just pull it and wait for a new one to show up. So here, the whole strategy shifts from removal to restoration. So for permanent teeth, there are two main options on the table. The first one is called a prosthodontic buildup. It's a pretty direct fix. A dentist basically just adds some composite material to the top of that sunken tooth, building it up so it matches the height of its neighbors. The second option, luxation, is a little more involved. It's a really delicate procedure where a dentist very carefully tries to wiggle the tooth, hoping to break that bony fusion and encourage that trampoline ligament to grow back. And all of this leaves us with a pretty fascinating final thought. Is a stuck tooth a problem that needs to be removed, or is it a uniquely stable foundation, that post set in concrete that can actually be built upon? As we've seen, the answer really depends on the tooth, the timing, and the person.